Smith, back so soon. So as you know, my name is Tasneem, and today the doctor's asked me to do an examination of your cerebellum. This is a small part in your brain that controls many different things. Would that be okay? Alright, amazing. So I'm just going to be talking to the examiner during this examination, but let me know if you're in pain at any time and we can stop, okay? So just examining the patient from the bedside, I don't notice any paraphernalia to indicate disease. Now, Mrs. Smith, the first thing I'm going to do is look for something called dysdiadokinesia. It's a big word, but really all I need you to do is just get your hands and just kind of do this back and forth for me. Alright, amazing. I don't notice any. And the next thing I'm going to do is ask you to stand up if that's okay. So if you just stand up and walk heel to toe, so kind of like this in a straight line, and if you wibble or wobble or fall at any point, don't worry, I'll be here to catch you. Okay, amazing. And the next thing I want to ask you to do is just kind of close your eyes and stand still for me. And again, I'll be here to catch you if you fall, although I really hope you don't because I'm not very strong. Alright, cool. So the next thing I'm going to do is just take a seat here if that's alright, because I'm going to look at your eyes. Okay, Mrs. Smith, so what I need you to do is, if you just see my two fingers here, I need you to look back and forth between them without moving your head. And again, okay, wonderful, I don't notice any nystagmus. And whilst I have you here, if you can just follow my finger without moving your head. Okay, amazing. Okay, so next one I'm going to ask you to do, it's going to be a little bit weird, but if you could just get your finger to your nose and see my finger here, if you could just bring it back and forth like this as fast as you can, and I'm just looking for any intention tremor. Okay, now I need you to say baby hippopotamus for me. I can't even say it, so don't worry if you cough. Okay, wonderful. And next, finally, what I'm going to be doing is looking for any hypotonia. So if you can just lean your legs over the side of the bed for me, and I'm just going to be moving them a little bit. Let me know if this hurts you at all. And I'm just looking for any loss in tone, and I'm just going to whoop, and see if I can see any brisk reflexes. Okay, so that's more or less everything. I'm just going to present this back to the examiner. So today I spoke to the lovely Mrs. Smith. I did a cerebellar exam, and I didn't notice any dysdiadokinesia or any other, pathological signs. So nothing to indicate MS or alcohol misuse or space-occupying lesion. But I'd like to take a full collateral history to kind of